Fall is fast approaching, which means flu season, and a probable uptick in cases of COVID. Of course, there's a vaccine for that, but there seems to be an epidemic of doubt among some Americans. We've asked our Dr. Jon LaPook for his diagnosis.
Thanks to all those shots in the arm, in the year 2000, measles in the United States was declared eliminated.
The CDC is warning about the rise in measles infections in the U.S. There have been 20.
But now it's coming back, with measles cases reported from California to Vermont. One big reason? Across the country in 2023, more families exempted their children from routine immunizations than ever before.
There's never been a better time in human history to tackle an infectious disease than today. There's so many things we can do, from vaccines to antivirals to antibiotics. And yet I am dumbfounded by the volume of anti-vax voices.
Dr. Howard Markel is a medical historian, retired from the University of Michigan. He's also an author and pediatrician. Dr. Markel says vaccine hesitancy is as old as the United States. In the 1700s, when smallpox was ravaging the colonies, some people were given an early form of immunization called variolation.
You went to a doctor who had this infectious material, dried pus and detritus of smallpox scars and so on, and then they would cut you open, make a slice of your arm and inoculate, put it in your arm. And half of the people got really sick and some of them died. So it cost a lot and it was dangerous.
But the people who recovered, they were immune.
Yeah.
Benjamin Franklin decided it was too dangerous for his sickly 4-year-old son, Frankie.
One of Franklin's great regrets was that he did not get his son inoculated, instilled with smallpox virus to prevent what ultimately killed him.
He went to his grave regretting that.
Absolutely.
In the 1800s, as a much safer smallpox vaccine was developed, many cities and states started requiring smallpox vaccination. At the University of California at Berkeley in 1902, it was mandatory.
What was the reaction here at Berkeley about a century ago when students were forced to get vaccinated against smallpox?
They were up in arms about it, and people in town cheered them on.
Professor Elena Konis is a medical historian at UC Berkeley. In 1905, the Supreme Court ruled the government has the authority to require vaccination.
This, importantly, had the effect of energizing a lot of anti-vaccine groups. And the anti-vaccine groups at the time believed that they were defenders of individual liberty.
But by the 1950s, there was one thing that united Americans: their fear of polio.
The 3-year statistics run 50,000 polio cases, 103,000 cases, 122,000 cases. Where will it end?
The idea that your child would be paralyzed or worse, condemned to an iron lung, this giant tank where your head's sticking out and that's how you breathe for the rest of your life, that terrified people.
An historic victory over a dread disease is dramatically...
When Dr. Jonas Salk invented the polio vaccine, he was considered a hero.
And the entire world heralded the discovery which assured an end to one of mankind's most dread diseases.
The greatest faith probably ever in the American medical industrial complex was around the 1950s. And here you had this photogenic Jonas Salk with his wife and his children, and they saved the world.
The 1950s might be considered the high watermark of vaccine acceptance. Vaccines were then developed for diseases including measles, mumps, and rubella. As Americans, especially children, got their shots, rates for those diseases plummeted. But it all ran straight into the counterculture decade of the 1960s.
As more and more doctors and public health officials were encouraging people to get vaccinated or encouraging their children to get vaccinated, people were saying, but hold on, I need to ask questions. What are these vaccines for? Who made them? What's in them? And why are they necessary? Can you tell me that?
The overwhelming medical consensus is that the benefits of vaccines have far outweighed the risks.
And we're talking about our kids.
But an upsurge in the anti-vaccine movement was fueled by a 1998 study in a prestigious British journal that falsely linked the measles vaccine with autism. It took 12 years for the journal to retract the study after concluding the research was fraudulent.
If you asked me 40 years ago, would I ever have to be defending vaccines like I do now, I'd say you're crazy.
So what happens in here?
This is the first step in our vaccine production process. We use fermentation technology. It's actually similar to the technology used in making beer.
Dr. Peter Hotez has worked for decades to develop vaccines at the Baylor College of Medicine and Texas Children's Hospital.
Everybody knows the life-saving impact of vaccinations.
One study estimated that by the end of 2022, the COVID vaccine had saved more than 3 million American lives.
I'm worried there's a full-on frontal assault on biomedical science. And
he's entered the public debate as a passionate advocate for vaccines and become a bit of a lightning rod.
Unfortunately for all of us, when Peter Hotez speaks, he discredits American medicine. He is a misinformation machine.
When we talk about anti-vaccine, anti-science movements, we call it misinformation or infodemic, as though it's just some random junk out there on the internet, and it's not. I want to convince you today that it's organized, it's deliberate, it's politically motivated, and it's having a devastating impact. It's reached that level of 200,000 Americans needlessly dying because they refused to take a COVID vaccine.
With public figures like former presidential candidate Robert F. Kennedy Jr. vocalizing vaccine skepticism, Dr. Hotez believes politics has turbocharged historical reasons for resisting vaccines. He sees a widespread issue.
Why would somebody want somebody else not to get vaccinated?
It's a form of political control, and it's a part of creating another issue to galvanize their base.
As an historian who knows about the arc of the vaccine movement in a way that most of us don't know, are you concerned about where vaccines are right now in terms of the public?
What I will say is that I'm not at all surprised. We've been here in some respects before. Vaccination resistance bubbles up when we use more vaccines and when we use more of the force of law to encourage or require vaccination. When I hear arguments and when I hear frustration that people aren't getting vaccinated, how can they not understand? My response is, let's try to understand their distrust. Let's try to understand their concerns, and let's take them seriously.
But as we try to benefit from the lessons of history, Dr. Hotez warns the clock is ticking.
The things that we're talking about today, like COVID-19, H5N1, they're the warm-up act. You know, Mother Nature's not being coy with us, right? She's telling us, I'm going to hurl a major pandemic at you every few years, and you better get ready. And by the way, you better convince your population to accept vaccines. Otherwise, the devastation is going to be unprecedented.